I want to introduce our keynote speaker who's going to kick the showcase off. This is Dr. Amanda Young. Amanda qualified at London Hospital in 1987 and had a varied career, including a year in Canada, before focusing on becoming a district nurse and community practice teacher in East London. This was followed by an academic career teaching a community nursing module prior to focusing on end-of-life care and becoming lead palliative care nurse. Amanda is undertaking a PhD in palliative care before moving back into nursing education at Anglia Ruskin University. And today, Amanda works at the Queen's Institute of Community Nursing, who've been a consistent partner with CSH for years and is a current SusQI beacon site. Amanda focuses on innovation and professional development programs and has been championing sustainability. So I will stop sharing my screen. I can see you there clearly, Amanda. So over to you.
Thank you, Aoma. Hello and welcome to the SusQI Showcase event. As Aoma said, my name is Amanda Young and I am the Director of Nursing for Innovation and Policy at the Queen's Institute of Community Nursing. And it's a real honour to be invited to open this showcase event, and thank you very much for giving me the opportunity. I am a nurse of a different era: starch caps, aprons, autoclaves and bedpan washers, when it was very rare to use plastic gloves, aprons or single-use equipment. I do sometimes despair of the impact that healthcare is now having on the planet. Whilst nostalgia and rose-tinted spectacles have their place, healthcare professionals today are often innovative and solution-focused in identifying what they can make a difference to, not only to the planet, but to people, and to recognising that preventing ill health in the first place can play a large role. I had the privilege of being one of the judges for the last year's Green Team projects, which was held by the Centre of Sustainability, and it included work from both primary and secondary care. Each project showed how small changes to services can make a meaningful difference, not just to sustainability, but to that patient care, which is so important. Many of the project outcomes and processes can be adopted into other services and across care settings to reduce the environmental impact of healthcare. My role at the Institute includes supporting community nurses with innovation projects, and this is particularly with garden projects which have been funded by the National Garden Scheme, who celebrate their centenary next year. These nurse-led projects have taken many forms and have benefited local communities across the country by improving the physical and mental health of those involved. We have had gardens in care homes, community hospitals, homeless hostels, children's centres, a library, general practice surgeries, within specialist autism services, and even in a prison. The projects have all brought nature to people, which has impacted positively on people's health and well-being. In many cases, has reduced the need for further healthcare intervention. This directly addresses the secondary driver of SusQI, which is prevention. For the past 3 years, the QICN has worked with the Centre to incorporate SusQI training into the innovation programme, and for the last 2 years we've been a Centre for Healthcare Sustainability beacon site, embedding sustainability not only into the garden projects, but also into the developmental programmes we run for nurses and allied healthcare professionals. This work often aligns with the NHS long-term plan by strengthening prevention and reducing future demand for healthcare services. Later, I believe you're going to hear from one of our project leads, Lucy, from an integrated autism service. Community nurses work alongside communities in many settings, including care homes, local authorities, schools, prisons, shelters, clinics, people's homes, community hospitals, and on the streets, and many more places. They also work with organisations that provide health promotion, signposting care, treatment, and support wherever it is needed. This places them at the heart of preventative healthcare, which is closely linked to the sustainability and is one of the key themes of the showcase. Recognise that small changes can make a big difference. Measure the impact, shout about it, and share the work that you do. You're all amazing, and I hope that you enjoy the rest of this showcase event. Thank you.
Thank you, Amanda. It's so good to hear everything that you at QICN is doing, and you bring up a very good point in that maybe we are now looking back at how we used to provide healthcare as a much more sustainable way.